Good evening. Thank you very much for joining us on the news at 7 on 90 International. We're live in Abuja. I'm Ruth Aguela. Let's start with the headlines. Senate Committee on Foreign Affairs commences screening of career ambassadorial nominees. Attorney General of the Federation, chief law officers in the Federation, and heads of courts gear up towards improving Nigeria's justice system. An Abuja-Kaduna train service gets a boost with new coaches and locomotives. We'll begin with global update on COVID-19. New Zealand on verge of eradicating coronavirus as International Council of Nurses announces the death of more than 600 of its members from coronavirus worldwide. Let's now join Adebola Brookslyn Sunday for more.
Data from the Nigeria Center for Disease Control shows that the center has tested 71,336 COVID-19 samples. Currently, the country has 11,166 confirmed cases of the virus, 315 deaths, while 3,329 persons have recovered and have been discharged. Lagos State leads those at the top of the table, while Kogi remains at the bottom. The Africa Center for Disease Control says the continent now has 163,599 persons infected with coronavirus, 4,611 fatalities, and 70,894 recoveries. On the COVID-19 dashboard of the Coronavirus Resource Center of Johns Hopkins University at about 7 p.m. Nigerian time, 388,763 persons have died from complications related to coronavirus globally, while 3,195,994 people have recovered from the virus. This is from a total of 6,615,318 persons who have been infected worldwide. Meanwhile, the International Council of Nurses says the death toll among nurses from COVID-19 in a survey carried out in 30 countries has surpassed 600, while an estimate of 450,000 healthcare workers have been infected globally, as the Council calls on governments to employ better measures needed in protecting healthcare workers from coronavirus. A New Zealand authority says the country is on the verge of eradicating coronavirus from its shores. It added that only a single person in the nation of about 5 million people is known to still have the virus, and the person is not hospitalized. I'm Adebola Brookslyn Sunday. Thanks for your time.
Thanks, Adebola. The chairman of the Presidential Task Force on COVID-19 and Secretary to the Government of the Federation, Boss Mustapha, says the task force will continue to monitor the ease of lockdown nationwide and will not hesitate to review any guideline when necessary. The chairman informed that the task force has continued to receive support from development partners and agencies in the areas of health kits in the fight against COVID-19.
The Presidential Task Force will continue to monitor the overall compliance of the easing of restrictions as well as evolution of any outbreak. However, we will not hesitate to review as we progress should the situation warrant to avoid preventable risk of transmission.
The NCDC molecular laboratories are still the WHO-recognized platforms for testing of coronavirus, as rapid diagnostic test kits give false and misleading results, and there's no treatment for coronavirus so far that has proven impact on morbidity.
Evaluated. But what it means is that results obtained from these test kits, they're not tenable for diagnostics, and they are deficient in sensitivity and specificity and are likely to give false results and mislead people.
The trials for chloroquine and hydroxychloroquine will go on, and we have no problem with that. But we are asking that we restrict the use of these medicines to those trial settings.
Let's look at other issues. Secretary General of the Organization of the Petroleum Exporting Countries, OPEC, is categorically that the rebalancing process of the global oil industry may be longer than anticipated under the prevailing uncertainties, downside risk, and given that global inventories appear to be continuing to build, although at a much lower rate than the record pace of late March and April. The OPEC boss at the 133rd meeting of the Economic Commission Board, held virtually, however, expressed optimism that the actions taken by OPEC Plus in April stopped short the race to $0 oil. In his words, Barkindo said, and I quote, "The decision taken by our members and our partners in the Declaration of Cooperation has been pivotal in reducing volatility and bringing back some semblance of stability to the market," end of quote. No individual stakeholder, Dr. Barkindo added, can have all the answers. It is only by reaching out and deepening the dialogue between reputable institutions that they can provide a better and broader sense of the rapidly evolving energy landscape. The OPEC, he stressed, will continue to work closely with the International Energy Agency, including regular consultations and International Energy Forum, to ensure open lines of communication between producers and consumers. The Ministerial Coordinating Committee on Health, comprising of all 15 ECOWAS Ministers of Health, held its first meeting. The video conference was chaired by Dr. Osage Ehanire, Minister of Health of the Federal Republic of Nigeria, with Professor Stanley Okolo, Director General of West Africa Health Organization, as co-chair.
The ministers were concerned that the pandemic continues to spread in the ECOWAS region, although the member states are at different stages of evolution. They noted that 14 weeks into the pandemic in the region, 35,115 people had been confirmed COVID-19 positive, of whom 56% still had active infection. 42% had recovered and 2% had unfortunately lost their lives as at 1st June 2020. They observed that despite the improved surveillance and increase in testing, only about 0.11% of the population had been tested to date. The ministers agreed to institute measures to mitigate the socio-economic impact of the pandemic on the population, mobilize more resources to support national and regional COVID-19 response capacity, strengthen capacity for contact tracing, isolation and treatment, expand health force through the use of community health workers, allied health professionals and healthcare students to assist in the public health response, such as contact tracing, and mitigate current shortage, decentralized testing, surveillance and case management to the district, with professionals and volunteers deployed to support local efforts, among others. The ministers tasked West African Health Organization to work with the Departments for Trade, Customs and Free Movement at ECOWAS Commission and the Ministerial Coordination Committee on Transport to develop guidelines and standing operating procedures on regional cross-border movement, whether by air, land or sea, for consideration by the ministers. These should cover the following areas: essential products including medicines, agricultural, food products and petroleum, commercial goods for trade and business, and passengers movements, motor parks and loading areas for passengers and goods, border posts or entry points for international travel, including air, land and seaports, risk communication for travelers and handlers of goods. The ministers commended the ECOWAS Commission and WHO for the technical and financial support to member states in coordination, financial support, training of personnel, and provision of diagnostic test kits and critical medical supplies, including personal protective equipment, PPEs. Obiageli Ugoke, NTA News.
Right, let's look at the legislature. The Senate Committee on Foreign Affairs has commenced the screening of 42 career ambassadorial nominees with a call to ensure enhancement of Nigeria's foreign policy objectives. National Assembly correspondent Abdullahi Aminu reports.
The list of the career ambassadorial nominees was contained in an executive communication to the Senate by President Muhammadu Buhari on May 6, 2020. The screening exercise by the Senate Committee on Foreign Affairs could have been completed within the 2 weeks deadline given to it. But for the lockdown in the Federal Capital Territory and closure of the National Assembly, that was not achieved.
Look at what the African Union is going to do, and also what ECOWAS is going to do.
Is to leverage on our natural endowments and block the necessary leakages.
We have to go around all challenges and make sure we fulfill this legislative action.
In another development, the Senate Committee on Capital Market has successfully screened the nominees for the Director General and the Board of the Nigerian Securities and Exchange Commission.
With the training that I have, I am able to really look at a financial instrument and really understand its risk return.
With funds like this, we can fix all this our infrastructure.
Post-COVID-19 economy of the country was the topical issue that the senators said require more than casual attention of the board if confirmed by the Committee of the Whole. From the National Assembly, Abdullahi Aminu, NTA News.
Still staying with the legislature, the Senate Committee on Niger Delta Affairs has commenced investigation into the alleged sacking of 20 management staff of the Niger Delta Development Commission. National Assembly correspondent Ignatius Onkwo reports on this and all the committee activities at the Senate.
On Tuesday, 12th of May 2020, the Senate mandated its Committee on Niger Delta Development Commission to investigate the alleged sacking of 20 management staff of the Commission. 23 days after the investigation is on, the Federal Civil Service Commission and the legal team of the sacked staff were summoned for submissions.
There has been no reason whatsoever other than that the forensic auditing, which is on the ground, which have been set down, they are found as persons who are likely to interfere.
The committee demanded to find out from the Federal Civil Service Commission if an external forensic auditor has the right to suspend a staff.
The first question, because we have press, does an external auditor or a forensic auditor have the right to direct that 1, 2, 3, 4 staff be sent on compulsory leave?
The public service would have seen nothing like that.
I wanted to also hear that, well, on account of alleged gross misconduct, bordering on mismanagement of funds and what have you of the Commission, the officers concerned were queried.
We cannot overrule. We have no business with them. Whatever they do, it is up to their governing board.
The Federal Civil Service Commission, however, explained that parastatals have their own rules different from that of the Federal Civil Service Commission. The committee will be expecting the Niger Delta Development Commission in the next meeting. Meanwhile, the Senate Committee on National Planning and Economic Affairs has screened 7 nominees as members of the Revenue Mobilization, Allocation and Fiscal Commission.
And I want to assure you that there's a lot that we are bringing to the table.
So they should expect disciplined organization.
The report of the committee will now be presented at plenary for confirmation. From the National Assembly, Ignatius Onkwo, NTA News.
And the House of Representatives is alarmed by the rising cases of rape and other forms of violence against women in Nigeria. The issue debated at as a matter of urgent public importance, saw House members expressing deep concern and urging authorities to do more to put a stop to these acts of crime, following a motion from Representative Rotimi Agunsoye, who cited recent rape cases of Uwela Omozua, Tina Ezekwe, and a minor in Jigawa State. The lawmakers urged states to hasten the domestication of the Child Rights Act and advised the Nigeria Police to establish special units to attend to cases of rape in all its formations. The need for relevant security agencies to bring to an end killings, armed banditry and kidnappings across the country was also adopted at plenary. The House wants the security forces to scale up response to avoid food insecurity, as such security breaches threaten cultivation of farmlands by farmers. We'll bring you more details of this in our subsequent bulletin. Let's take a break. We'll be back shortly. Stay tuned.
Nigerians, let us take responsibility. Stay healthy, stay safe, and curb the spread of the virus. Take responsibility. The coronavirus spreads from one person to another. Let us avoid crowd gathering of any kind for any reason. Take responsibility. Avoid traveling from one state to another during these lockdown restrictions. Obey all the rules that are put in place. Take responsibility. Stop spreading fake news and unverified reports about the coronavirus. There is no known cure for COVID-19. Take responsibility. Observe all the measures that can help stop the spread of the virus. Together, we can do this, but only if we take responsibility. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
Thanks for staying with us and joining us via Zoom to give insight on coordinating committee on the meeting that was held is the Minister of Health, Dr. Osagie Ehanire. Thank you very much for joining us.
Thank you for inviting me.
Okay, now I'm sure you can hear me. ECOWAS member states already have their response. Okay, I'm asking a question. ECOWAS member states already have their response plans and actions. Is there anything different in what they have been doing so far? And what are the resolutions at the meeting that was held today?
Well, the meeting was held yesterday.
Okay, sorry for that.
On the 2nd.
Okay.
And it was to align the responses of various countries of West Africa. We're all in the same region, we share borders and we also share culture, and we're all impacted by the outbreak of COVID-19. So a meeting like this is the first we've had, and it's to share experiences and know what each one is doing, and able to take lessons working well in one place and review the ones that we think are not working well. We'll also look at the impact on the economy and on the people, particularly those countries that have implemented a lockdown, and even those who have had a restriction. We have a large number of people who live from hand to mouth, who are daily paid workers. So we look at the lessons we can learn from what one country has implemented to alleviate the difficulties that their citizens have faced. And of course, we look at the borders, those countries that are contiguous. At a time when the borders are open, how will the movement be like? We look at the essential products that will move, medicines, food, and there are others that are for business, and there are also passengers that will move. So a protocol that will allow normal relations to come up is being prepared with the standard operating procedure.
Okay, part of the decisions at the meeting we made to understand is to expand the health workforce through the use of community health workers, allied health professionals, and health care students to also assist in the public health response, such as contact tracing and mitigating current shortage. How would this be achieved in Nigeria?
Well, in Nigeria is to utilize the healthcare workforce, particularly from Primary Healthcare Development Agency, from community workers, and in fact using the health workers from the Ministry of Environment, who are the allied health workers. They will join us. It is first to trace those who are positive and their connections. As you know, when we have one case, we want to trace all the contacts.
Okay, but has there been any avenue to compare notes by member states in terms of COVID-19 response?
Where they are and test them or isolation is complying. So we also use the opportunity to check compliance and to see if any is developing complications. And this is particularly important when you're in the era of community transmission.
Okay, I was asking earlier, has there been any avenue to compare notes by member states on COVID?
At that time, the spreading from people from place to place and those who have not traveled.
Minister, I don't know if you can hear me clearly. Your signal is kind of breaking, but
so community health workers increased carry out all these activities.
Okay, we seem to be having poor signal there, but thank you very much, Dr. Osagie Ehanire. Thank you for your contributions on the news. Let's look at all the issues. The federal government is set to commence the implementation of the Mechanized Agriculture Revolution program in the country, tagged the Green Imperative. Information and Culture Minister Lai Mohammed said it is part of the present administration's deliberate policy of ensuring that the sector is made viable. The minister stated this at a media briefing in Abuja. Let's hear from Anthony Forson.
The Information and Culture Minister, Lai Mohammed, explained that the Green Imperative Program is a Nigeria-Brazilian bilateral agriculture development program. The scheme is an outcome of Nigeria's decision to enroll in a government-to-government More Food International program. The $1.2 billion program will be funded by the Brazilian Development Bank.
The program will import completely knockdown parts of about 5,000 tractors and numerous farming implements.
Similarly, 662 local governments have been programmed for the mechanized service scheme to be operated by the private sector. Lai Mohammed added that the scheme will create about 5 million jobs as well as create a sustainable supply chain of agricultural raw materials for large manufacturing companies.
This will create 774 service centers nationwide to mechanize our farming methods and process or add value to farm produce locally, leading to efficiency and eliminating post-harvest losses, thereby cutting down cost of food all year round.
On his part, the Minister for Agriculture, Sabo Nanonu, chronicled the gains derivable from the mechanized agri-revolution.
This mechanization is going to affect 632 local governments across the country. And there will be accompanied to that 140 processing centers. These processing centers will be designed in such a way that clusters of local governments, maybe in 5 or in 6 or in 7, that are producing common products, will have a processing center for that common product to process for local consumption and to process for export.
With all plans and negotiations completed, the scheme, the Agri Minister assured, will take off soon. In Abuja, Anthony Forson, NTA News.
If you are a beneficiary of the NHIS, then this must be good news for you, as the new Sheriff of the scheme unveils progressive and transformational programs to ensure universal health coverage and digital access to health care. Well, these plans were unveiled during a visit to the management of the Nigerian Television Authority in Abuja. Momso Damian Deti will fill us in on that.
You went to the hospital, you asked them your NHIS, as soon you see the reaction in their faces, like as if they are giving you some drugs free. I don't understand. And mostly they don't have drugs. They write everything, you should go to the pharmacy and buy.
The quality of drugs that we get is not what it should be.
Once you go to the hospital and it's not malaria or typhoid, they will tell you that they have to write you a HMO, you will have to wait, and if it is an emergency, that's how you will be waiting.
These are a few of the myriad of complaints coming from beneficiaries of the National Health Insurance Scheme. A unique paradox, a health intervention scheme dearly in need of a shot in the arm. That shot might have come in the shape of a new boss, Professor Muhammad Nasir Sambo. So, hopefully, all the complaints recorded earlier will now be a thing of the past as he sets the gear in motion to ensure a smooth ride in subsidized health insurance nationwide.
Quality healthcare services to every Nigerian. And we are approaching this through stabilization of the National Health Insurance Scheme, in the rebranding the organization that we are doing, entrenching value system, ensuring transparency and accountability, and we have created a roadmap for attainment of universal health coverage with the enrollees, with the healthcare providers, with health maintenance organizations, with state health insurance agencies, with drug manufacturers, with other relevant stakeholders.
This visit to the Director General of the NTA in company of the management theme is to solicit stronger ties for wider coverage to keeping Nigerians abreast of the rebranding processes as they unfold. It is a venture the NTA is ready to key into, since access to quality healthcare service is wealth indeed.
You take care of the health needs of the population. That would amount to taking off about 40% of the worries of that population. This is very significant. NTA is part and parcel of the National Health Insurance Scheme. We'll work assiduously together, to ensure that the goods are delivered by the administration of President Muhammadu Buhari.
With this agreement sealed, Nigerians can just relax and enjoy the benefits to come. In Abuja, Momso Damian Ati, NTA News.
Good news indeed. Well, that's the news. Thank you for your time. I'm Ruth Aguela. Bye.